Hello, it's Bruce Williams again, and today I want to present part 7 of my series on the selected gross pathology of the reproductive tract. In this lecture, we're going to start to look at diseases affecting the gravid uterus and the placenta by starting with the uterine diseases, and then we'll look at the placenta. We'll look at some of the normal structures, we'll look at some of the incidental findings that are normal in various species and you don't want to mistake for abnormal findings, and then we'll talk in some general terms about placental disease. And then in the second part of this lecture, which is going to be a separate lecture, we're going to talk about specific diseases that attack the placenta in various animal species. As I do at the beginning of all of my lectures, I want to thank my friends and colleagues who have provided me with their images over the years, either through online collections or directly, which allow me to put these lectures together. Okay, so let's start with displacement of the gravid uterus. A lot of things can happen to such a physiologically variable organ, which will grow hundreds of times its normal size during the course of pregnancy. And so when you have this large extra weight in the uterus, it's going to be prone to twist. Normally, it's not a common finding in any species, a little more common in larger animals. The difference between the horse and the cow, where it's a little more common, and the dog and the cat, is the presence of the intercornual ligaments, which tie the two ligaments together, are very strong in the cow and the mare. They tend to hold the horns together so the entire organ will twist at once. In the dog and cat, you don't have those ligaments, so you more often will see one side twist versus the other. So as we see here in this queen or female cat, one of the uterine horns has twisted. Normally it twists at the body of the uterus and up at the mesoovarium, so you get entire involvement of the horn. Here we have marked venous infarction here because the veins have lower blood pressure. The body can continue to pump blood into it through the arterial system, and it'll collect because the veins collapse much faster. Generally in these cases, the fetus will die. If the cervix is open, you may have contamination with bacteria, and you will get endometritis. Otherwise, you may have mummification. And in the dog and the cat, which has much more of a thin-walled uterus, it will often split along the side, expelling the fetus into the abdominal cavity, and it might be misdiagnosed as an ectopic pregnancy if the animal survives. Here's a picture of a twist of a uterus in a mare. You can see the entire organ is involved, and sometimes these will actually untwist if the animal is shipped from the farm to a necropsy facility, not done on site, and then you have a much more difficult diagnosis to make. So that's uterine torsion, another very common displacement, especially in ruminants. We've talked about this before in the section on diseases of the uterus, is the uterine prolapse, which often accompanies vaginal prolapse. One of the problems in cattle is that you may also have part of the bladder or intestines involved in this prolapse. Usually this is seen in more mature cows in the last trimester of pregnancy or immediately after delivery. There's a whole lot of factors that will contribute to this, including, as we said before, the age and how many previous calves or sheep, baby sheep that the animal has already had. The condition of the animal. Fat animals are more predisposed to something like this. Concurrent ruminal distension, which sort of pushes everything forward. A lack of uterine contractions or inappropriate uterine contractions, maybe in the face of hypocalcemia, will predispose to this. And then if the animal is delivering downhill, as sheep are very wont to do, that the gravity will help. So a lot of these things go together to result in uterine prolapse. But it's not just a condition of cattle. We also see it in pigs from time to time, and I think you can see it in just about any species. Here's a mouse. And during the course of delivery of the pups, there was prolapse of the vagina, resulting in dystocia and intrauterine death. Here is a situation that occasionally happens in the mare, and this is rupture of the middle uterine artery. Usually this is seen in older mares. A lot of people have tried to associate this with other conditions, especially low serum copper level. The hemorrhage is extensive. It goes initially into the broad ligament, ultimately into the body cavity. Usually this happens at foaling or within the 2 days after foaling, and of course this is a life-threatening occurrence. Histologically, examination of the arteries will show pre-existent degenerative changes. As I said before, this is usually in older mares that have had several foals previously. One of the things that you probably also need to consider would be birth trauma, or sometimes, unfortunately, veterinary assisted trauma, especially in something like cattle where there might have been some form of traction or assisted delivery. And unfortunately, we are often not quite as gentle as we think in these particular cases. And in a lot of cases, if you see the uterus of animals immediately postpartum, you can see these tears in the mucosa. Here's one in the body of the uterus extending into the area of the cervix, and this is a tear that might have been created during a normal birth by a somewhat misplaced hoof. Involution of the uterus is a very normal process that in the absence of any pre-existing disease will happen within a period of up to 3 to 4 months. Here is normal involution of the uterus of a cow, and you can see that these are the caruncles, which have decreased to fairly small size, which is normal for this species. Another picture from a cow, and you can see the presence of this sort of hemorrhagic fluid. This is known as lochia, and this picture was taken approximately 10 days after parturition, and so this is part of the normal involution and should not be interpreted as endometritis. In the dog, there is a condition which is associated with delayed or non-existent involution of the placental sites. And it's called subinvolution of placental sites. Normally the uterus should be involuted in the dog between 12 and 15 weeks, totally healed up. In some animals with this condition, after 15 weeks, you can see preservation of the normal zonary placentation. Let's take a quick look at what that looks like in the normal fetus. Dogs have zonary placentation. It's a band of placentation around each individual fetus. And in cases of subinvolution of placental sites, you will see preservation of these areas of zonary placentation. That and the remainder of the endometrium will be covered with a layer of hemorrhage and fibrin and partially regenerated endometrium. Deep to this, you'll often see large plaques of collagen, which are part of the normal involution process, usually disappear between 4 and 6 weeks, and they will be preserved, and you may even see residual trophoblasts. These animals may be anemic because they have been bleeding, and this, of course, like any other interruption to normal involution will predispose the animal to the development of endometritis and possibly even pyometra. This is an absolutely fantastic picture of this condition. Many of the pictures that you will see are a little more like this. There's a bloody discharge, that's why the animal is anemic, and you will still see these areas of where the zonary placentas have previously attached. That's subinvolution of placental sites. Now, one of the somewhat frustrating things about talking about the gravid uterus and placenta is the tremendous diversity of how the different species do it. And I always feel like I'm sort of jumping between species. But nothing is as diverse in the animal kingdom as the generation of the fetus and placentation. And we'll look at a couple of different ways that the species will do it. This is a carnivore placenta. This is a dog, and we've already talked about the traditional zonary placentation that carnivores have. Carnivore placentation is deciduate, which means that the trophoblasts of the fetus will invade and destroy the superficial endometrium, and there is only one layer between the fetal placenta and the maternal vasculature, and that is the endothelium, because the superficial endometrium and the connective tissue are eroded away at the connection of the fetus to the uterus of the mother. Ruminants do it very differently. Instead of a zonary band, they have these proliferations of fetal tissue called cotyledons. It's a cotyledonary placentation, which connects to the bumps in the uterus that we've already talked about, the caruncles. And this is the only place where the placentation occurs, at these sort of button-like, when the connection of the cotyledon and the caruncle is called the placentome, and these are scattered across the maternal endometrium. This type of placentation is non-deciduate. Trophoblasts don't significantly invade or destroy the endometrium. The endometrial epithelium and connective tissue are intact. There are 6 distinct layers to these particular placentas, including the uterine epithelium, the maternal connective tissue, and the capillary endothelium on the maternal side, and then the trophoblasts, the mesenchyme or the allantochorionic connective tissue, and the capillary endothelium. It's a 6-layer fully developed placenta, which only occurs at specific spots in the endometrium. Horses do it differently again. They have a very diffuse placenta which covers large areas of the uterus. You can see that it often goes up into both horns. It is a diffuse membrane which attaches, very similar, has 6 layers. It's epithelial chorial. It's non-deciduate. The trophoblasts do not invade the endothelium, and it's diffusely attached along the endometrium. One of the spots which it does not attach, cannot attach, is adjacent to the cervix. And you will see that here is the placenta with all these little villi which are attached to the endometrium, and then in the area where that uterus goes into the cervix, you have the chorion, or the placenta, has no villi on it. This overlies the cervix. It is known as a cervical star. We'll talk about that subsequently, because the cervix is the area where most diseases enter the gravid uterus, affect the placenta, and in many of these bacterial or fungal conditions, the concentrations of lesions are around the cervical os. You can also see similar areas of avillus placentation in the equine placenta overlying large vessels. This is also the place where the placental membrane during delivery of the foal is going to rupture right down through here. So this is where the baby is going to come out. Cervical star. And remember that term because we will see that again. Pigs also have a diffuse epithelial chorial or 6-layer placenta, much like horses do. And when we talk about non-human primates, including man, humans and non-human primates have a discoid placenta, a large focal area of attachment, an exchange of blood and nutrients between the mother and the baby, but it's a large disc. There are a few non-human species like cynomolgus macaques which may have 2 discs, but this is known as a discoid placenta. It's also seen in rodents. It is deciduate, so the trophoblasts are actually going to invade the wall of the uterus, and it has almost it's a hemochorial type of placentation, which means that all the maternal layers are eroded, leaving the trophoblasts in direct contact with maternal blood. If you think about the condition known as trophoblastic embolism, which is occasionally seen in humans and non-human primates and rodents, in which trophoblasts will end up in the pulmonary circulation. This is because they have a hemochorial type of placentation, and those trophoblasts do have access to the systemic circulation. Let's take a little closer look at placentation in some of the various species, some of the various mechanisms and normal findings that we will see as we examine mostly the membranes of the fetus, a little bit of some of the connection sites. I do want to mention these particular structures. Before the placenta, that big placenta, which takes a long time, is fully formed in the horse, there is a type of very specialized trophoblast, which arise from the chorionic girdle surrounding the blastocyst, and they break free around day 35. This is before the corpora lutea has fully formed within the ovary, which will help to maintain the pregnancy. And so these cells migrate to the endometrium, and they form what is known as the endometrial cups. This is the source of equine chorionic gonadotropin to support the pregnancy, the development of the placenta. The corpora lutea will eventually take over, producing all the progesterone needed around day 100 to 120. So these cells start to hypertrophy. If you look at them under the microscope, they're a very bizarre area of the uterus, and they're often sent in as one of these, what is this? They're large binucleate, maybe multinucleated cells, heavily vacuolated because they are producing a steroid. And these endometrial cups will start to grow. They will probably get as large as they're going to between 60 and 75 days, and then the body will reject them, sort of like a graft versus host rejection, and they will eventually be sloughed off as unnecessary. They may be later contained as necrotic debris in pouches off of the chorioallantois. So, endometrial cups, a temporary source of equine chorionic gonadotropin designed to maintain the pregnancy during early fetal development and development of that large placenta. Here is one of my favorite slides of all time, which was given to me by Dr. Helen Ackland, worked for many years at the University of Pennsylvania. And there's an old adage that says that you can read a newspaper through a normal placenta, and that is exactly what we're doing right here. She very well demonstrated how the normal placenta, and this is about the only picture I'm going to show you of a normal one, is very thin. It is translucent. Here are the cotyledons. This is the fetal membrane, which has been removed. So this is the fetal tissue that is expelled during birth process, hopefully in cattle. And you can see what the normal is going to look like. Memorize that. I'll show you one more, Dr. Jose Ramos Vera. Okay, it is clear, very translucent, no exudate, and that's the only other normal one I'm going to show you during the remainder of the lecture and the next lecture. Now, the placenta is a very forgiving membrane. There are a number of modifications that it will do, and in ruminants, because the area of connection to the maternal vasculature is very limited to these areas where the placentomes form, some animals may not have enough surface area on the placentome itself. So in the cow, they will recognize this. And here are our normal cotyledons, and you will see these areas in between, in the intercotyledonary space, where small cotyledon-like tissue has formed. This is known as adventitial placentation. It is the body's recognition that there is not enough surface area for exchange of blood, nutrients, and waste products, so it is the placenta's attempt to try and increase that amount of area. So when you see that, you know that there has been a degree of placental insufficiency. Here's another great picture from the University of Georgia, and you can see the cotyledons here, and then all of this additional adventitial placentation, which has been put down to try and increase the exchange of blood between the developing fetus and the cow. Just one more picture, another beautiful picture from the University of Georgia, which shows these areas. They're not quite as distinct as in the previous ones, but all these areas of increased congestion, I won't say hemorrhage because you can see it's tissue, is adventitial placentation. Now, what are the consequences of insufficient exchange, placental insufficiency in ruminants? Well, you will end up with one of two different conditions. Okay, hydrops amnii or hydrops allantois. Okay, hydrops is the term that is applied to placental insufficiency or uterine insufficiency, and both forms result in an increased production or accumulation of fluid within the amniotic sac, which surrounds the fetus, known as hydrops amnion, or the allantoic sac. Hydroallantois is a more common condition. Remember, the allantois is an outpouching, essentially an outpouching of the gut of the developing fetus, and it is largely used for the collection of liquid waste from the fetus, which is normally taken away by the placenta, and the allantois is kept within a normal size. If the placenta is insufficient, there's not enough surface area for that, the fluid can actually, in some of these animals, reach 150 or 250 liters, and there will be massive distension of the animal's abdomen, as seen here. On the other hand, hydrops amnion is often a defect, or maybe a defect, of the fetus. The amnion is the fluid-filled structure that surrounds the fetus, and the fetus continually swallows amniotic fluid, and it's absorbed, and then part of it is passed back to the mother for excretion. But if there is a defect in the gastrointestinal system, then they can't swallow it, and that fluid will accumulate. So hydrops allantois is more of a deficiency, a placental insufficiency, where there's just not enough placenta to move the waste out. And hydrops amnion is a defect in the fetus. Both of them end up with accumulation of large amounts of fluid within the fetal membranes, and knowing where it accumulates or how quickly it accumulates, because usually hydrops allantois is something that accumulates very quickly. The placenta is essentially overwhelmed. Everything's doing fine until it hits that tipping point where it's not sufficient. Then it accumulates very quickly because of the digestive abnormalities of the fetus. Hydrops amnion accumulates much slower over the last half of gestation. But knowing how quickly this came on and careful examination as to where the fluid is accumulated will help you identify the defects that predispose this. Generally, these animals, regardless of the ones that have hydroallantois are generally sent to slaughter, because once the placenta is shown, or once the animal is shown that it can't develop a good placenta, that's probably not going to change. But hydrops amnion is one where the animal, the cow, can actually be salvaged, because that's a fetal defect. So very distinct syndromes. They look identical until you get very deep into your investigation. Another form of placental insufficiency may be seen in the horse, and I like to say that when it comes to horses, twinning is not winning, okay? Because we've already seen how large, complex, and how much room the normal diffuse placentation of the foal takes up within the uterus. Okay, when you put two foals in the same uterus, they can only get about half of the placenta, and it's not a situation which predisposes for good nutrition. Generally, at least one is seen here. Often both of the foals will suffer the results of placental insufficiency. We also talked about twinning in cattle in the previous lecture on intersexes, in which the multiple connections between the blood supplies of the twins will cause a mixture of the blood supply. And if one of those calves is male, it will result in the transfer of testicular determining factors, and will result in a masculinization or a marked lack of development of the tubular structures of the reproductive tract, including the uterus, which will be very hyperplastic, and hypoplasia of the ovaries in a condition which is known as Freemartinism. So twinning in large animals is generally not winning. Placental mineralization, especially in primates, it's very common, but you can see it in just about any species, including this horse placenta. It's an incidental finding. People like to look at it, especially when the animal, there's been a stillbirth, an abortion, or something like that. And when you're examining the placenta, and people say, well, there's mineralization here because they don't see anything else. And a lot of abortions or stillborns, you just don't find anything. And so people look at mineralization, they say, well, there's got to be something here that probably is abnormal. It's dystrophic mineralization, there was necrosis, and don't make that assumption, because mineralization, especially in the allantois, a little more than the amnion, is a very common finding, especially in non-human primates and humans. It's usually an incidental finding of no clinical significance. Something else that's an incidental finding, absolutely beautiful in ruminant placentas, but doesn't really mean anything, are these amniotic plaques. These are little plaques of epithelium, and it's epithelium that is sort of sloughed off of the surface of the developing fetus, and it sort of trickles down and falls onto the amnion surrounding the fetus, and it will grow there. Okay, it doesn't know whether it's growing on the amnion or it's growing on the surface of the baby. So it just goes ahead and grows, and you get these epithelial plaques, and they're of no moment. They're pretty to look at, but they are not a pathologic finding. Here's a fun structure that you can see in all sorts of different placentas. It's not just seen in horses. It was identified primarily first in horses, and you'll find these structures within the allantoic sac. Remember, that's the one that collects waste products, and these are known as hypomanes, or some people call them allantoic calculi because they don't like the name hypomanes. And they're just sort of an accumulation of various waste products, including lipid and degenerate blood cells and some mineral. They're generally sterile, and they're really of no moment as well. If you cut into them, nice picture by Raquel Rech, which demonstrates sort of this lamellation calculi-like material with just accumulation of progressive layers of this cellular debris. So often seen in ruminants, you can see it in horses. Here's one in a non-human primate, in the allantoic sac of a non-human primate. Okay, something else that you will see in the allantois are these pouches. These are known as allantoic pouches or allantoic vesicles, may be seen in horses or cattle. And usually, the reason we also mentioned that sometimes the endometrial cups in cattle will be just sequestered in allantoic pouches. But usually this is the result of a long-standing increase in venous hydrostatic pressure from a wide range of origins. Maybe it's the position of the uterus, a mild decrease in venous return. It can also be seen in much larger numbers with umbilical cord torsion, which decreases venous outflow, or maybe even right heart failure of the developing fetus. So they're seen very commonly in the placenta of a number of species, and usually are not associated with any clinical abnormalities at all. So you'll see a couple of them. When you start to see large numbers, you do want to worry about for some reason, the venous outflow from the fetus was not adequate. But usually you'll never find anything wrong, and it's considered an incidental finding. So my good friend Raquel Rech at Texas A&M had the presence of mind on the autopsy floor one day to capture three of the incidental findings that we have talked about already. Can you identify all three? Well, here's that cervical star. It's an incidental finding. It's the non-villus part of the placenta overlying the cervix. Here's that hypomane, or that putty-like material that you may find in the allantois, and here are the chorioallantoic pouches. This animal's probably absolutely perfectly normal. These are the kind of things that you would expect and not get very upset about. Here's a pretty rare finding in the horse, and this is a remnant of the yolk sac, and you'll see this in along the placenta, usually in the area of the umbilical cord. The yolk sac is part of the circulatory system of the developing blastocyst very early on in development, and after the development of the umbilical cord, it has absolutely no function. But you may see these very primitive yolk sacs. Yolk sac is usually incorporated into the developing gut of the fetus, and sometimes there is another remnant that you may see very rarely called Meckel's diverticulum, which is like a small outpouching of the intestine that may be seen in various animal species, both birds and mammals. So yolk sac remnants. Okay, so we're going to spend the rest of the lecture, just a couple minutes, talking about retained placentas in ruminants. And we looked early and explained the connection between the cotyledon of the fetus, the caruncle of the cow. The entire unit's called a placentome. And normally, expulsion of the placenta occurs somewhere between 4 and 10 hours after parturition. The normal expulsion of membranes occurs during that window. Retained placenta is generally defined as retention of those membranes 24 hours or longer after delivery. The incidence in healthy cows may be up to 15% in some cases, and it's generally attributed to a lack of neutrophils into the area of separation, which liquefies the area, allows the separation of the two layers, the cotyledon from the caruncle, and for the animal to expel those membranes. This is a great old picture. Some of these pictures are somewhat old. I guess retained placentas are not the most exciting thing to look at. But you can see this is the caruncle. You can see the layer of the caruncle here, the connective tissue, the underlying uterus. And this is about 2 days after parturition. You can see that there's already large areas of hemorrhage, of infarction, of necrosis, and all of this tissue will slough back down to the neck of this caruncle, and we've seen what the involuted uterus in a ruminant is supposed to be about 2 weeks out. You'll just see these bumps in the surface of the uterus, which are maintained in the uterus in animals that have had a calf or multiple calves. So you'd see those down the road. So if the membranes are not expelled within 24 hours, if there are still some hanging out through the vulva, that's considered a retained placenta. And of course, this coupled with the open cervix is going to form a very easy path for a number of pathogens to get into the uterus and set up a good endometritis. That's the major sequela of retained placenta, is endometritis. It's also been associated with mastitis and displaced abomasum, but the very logical conclusion is going to be it's going to be a very nice ladder for bacteria to get into that regressing and involuting uterus. The cause of retained placentas are many. Pre-existing disease, obviously, which we're going to look at the next lecture, like infectious agents or fungal infections, are going to make it very difficult for the placenta to separate at that point. There's going to be so much inflammation that the influx of a bunch of neutrophils is really not going to make any difference. So it's going to hang in there. You also see increased amounts of retained placentas in dystocias, any type of abortion or stillbirth, advanced age of cows or poor condition, maybe bad environmental conditions. All of these will contribute to the incidence of retained placentas. And so as we look at some of these, you will see that here is the right horn of the uterus looks pretty good and is involuting normally, but left-hand side doesn't look quite so good. And there is retention of these membranes. There's actually some vascular structures that are left over that should have been expelled, and for one reason or another were not expelled. Usually some form of concurrent disease is a major cause of something like that. And then over time, we will see, and one of the major identifiers of retained placenta, at least for the astute veterinarian or the astute farmer, is going to be the foul smell, because the cervix is open and you can smell the chronic endometritis. You can culture just about anything out of this. And sometimes, can you imagine what this probably would look like? And this is inside a large uterus, and it's brown and it's foul smelling, obviously retained placenta and severe endometritis. Now, sometimes these animals will recover. Here's a more chronic version where some of the cotyledons that were not separated have undergone necrosis and sort of an inspisation, and you have these calculi within the uterus, and this is also the sequela to retained placenta. Okay, so we've talked about the placenta, a little bit of how it forms in different species, some of the incidental findings, and the general concept of retained placenta. Our next lecture, we're going to focus on some of the specific diseases that affect the placenta. I'm going to follow that with a lecture on fetal abnormalities and diseases of the fetus. We will wind up this lecture series with a final lecture on diseases of the mammary gland, which of course becomes especially important during parturition and the immediate period following that. So I thought that I would put that in this lecture series as well. I look forward to presenting those lectures, and I hope that you'll come back and listen to them, and that you enjoyed this lecture. Maybe you got a couple of new ideas or a little bit of new knowledge on it. Well, we covered it in 45 minutes. That's pretty good for me. So I hope everybody has a fantastic day, and please keep coming back to the Foundation's Facebook page and YouTube channel for more of these lectures. Thanks so much. Bye-bye.